Well, hello, it's Bruce Williams again, and today I want to present the 8th lecture in my series on the selected gross pathology of the horse. We're going to talk about musculoskeletal issues in the horse. Before I start, I want to thank all my friends and colleagues listed here for providing me these great images for these particular lectures. Let's start with an uncommon disease which is usually seen in stillborn foals, primarily in a couple of breeds, such as Peruvian Pasafinos and Appaloosas, but this defect has been seen in other species as well, especially humans and cattle. This is a condition known as Osteopetrosis, and if we look at this foreshortened long bone, you will note that there are two large pyramids of unremodeled bone coming down from the growth plate, and the cortices are extremely thin. There's so much bone in the marrow cavity of this bone, there's no room for marrow. These animals are generally extremely anemic as well. Osteopetrosis is a defect in osteoclastic bone resorption, both in mammals and in birds. But in mammals, it has to do with a genetic mutation which results in a lack of acidification at the site of the osteoclastic ruffled border. Remember that osteoclasts remodel mineralized bone coming down from the growth plate, and they turn it into the trabecula. Osteoclasts are also required to form the osteons, which compose the lamellar bone of the cortex, so it's very thin. This is not just a disease of the long bones. We see it in bones throughout the animal. In the head, these animals often have an undershot jaw, maxilla or brachiognatha inferior, and malocclusion because the bone is so sclerotic that the teeth can't erupt from it. These animals are often born with multiple rib fractures because of the thinness of the cortices, as well as the tremendous amount of cartilage within the primary spongiosa, which makes these bones, both the long bones and the ribs, very prone to fracture during the birth process. You will see a lot of osteoclasts in this bone. As a matter of fact, you may see more than normal, but they're often seen at a distance from the interface in the Hauschilt's lacuna, where they should be residing in. In birds, the condition is caused by a virus, but in mammals it is a mutation. A number of genes have been identified as responsible in humans, and one, the SLC4A2 anion exchanger, has been identified as the cause of this in Angus cattle. To my knowledge, no gene has been definitively identified in the disease in the horse. Another disease that is unfortunately not uncommon in young foals are joint infections. They often will result as a naval infection, which becomes systemic. And if the septic emboli from the infected navel get into the bloodstream, they often will end up in the joints or in the bone. This usually manifests within the first 2 weeks of life as painful, swollen, often multiple joints. On gross inspection, early infections don't have a whole lot of clinical signs, and other than the fact that the animal is painful and won't walk, it can be a very difficult morphologic diagnosis on a simple digital image. Here we see a small amount of exudation and fibrin, a little bit of bubbling underneath the joint capsule. But if someone wasn't to tell me that this animal had multiple swollen joints, it'd be very difficult to make that diagnosis on this particular picture. Occasionally I get the question, how many joints should be opened on an autopsy? And I'm going to go back to Dr. John King, who taught me that 7, the number 7 is important to open 7 joints in the autopsy to make sure that the animal doesn't have some form of septic arthritis. Now, you can open the joints of the legs, you can open the joints of the fetlocks, you can open the hip, you could even disarticulate the skull, and that would count as a joint. But make sure when sepsis is a question in a young animal or even an adult animal that you open at least 7 joints. As the infection gets more deep-seated and rooted, you are going to see a thickened joint capsule. The exudate within the joint will turn from a very thin serous exudate to a more suppurative exudate. You may have clots of fibrin floating within it. There may be blood in it, but that often is an artifact of posting. So don't put too much credence just because the fluid within the joint is red. Whenever we think about joint infections in any young animal, whether it is a ruminant or a horse, coliforms are going to absolutely lead in terms of prevalence. Remember, this animal is born and has essentially an open wound, has the umbilicus, and it is laying down in the same place that the mother poops. E. coli, Salmonella, Actinobacillus are ubiquitous in that environment, and they are the most common offenders. Now, one of the problems that we will see with coliforms and the joints is that in septic animals, they often will get into the bloodstream, and in the very small hairpin vessels in the growth plate. Remember, the osteoclasts are going in there. We have the breakdown of the cartilage columns, and then you have vascularization of that, and that vessel goes in. It takes a very sharp turn, and the endothelial cells at the top of that turn are often very porous, and it's a great way for bacteria to colonize the area just underneath the growth plate. People call this Separative Epiphysis in the foal. Remember that the blood supply to the joint is provided through a main arteriole that branches both to the synovial membrane and to the epiphysis. So if an animal has a septic arthritis, it may also be showering the epiphysis with bacterial colonies as well. The most common organisms that we see in young foals, as we said before, are coliforms and Actinobacillus, as well as Salmonella. In older foals, we may see gram-positive organisms sneak in there, like staph and strep as well. This is a fantastic lesion, which you can see in foals, especially foals with a bacterial shower to the epiphysis. And what we're looking at is an infarct of the spongiosa due to occlusion of vessels, and this bone is all dead. It's an unfortunate complication of sepsis in the foal. You can see that there are holes here. The dead bone has no blood supply, so no neutrophils can get into it. The hemorrhage accumulates on the outside because the blood does not get into this bony infarction. We have a large area here where the bone is being resorbed by neutrophils. Ultimately, it will become sclerotic if the animal survives, and obviously this one didn't, but if the animal survives, then it will be walled off by granulation tissue and additional bone to form a sequestrum. You can see this in young calves, septic calves as well, but not as often as you will see it in foals. Here's one that is a little older. You can see the effect of inflammatory cells on this necrotic bone. Now, it's interesting that you only see this on this side of the bone. The growth plate appears to be very effective in preventing the spread of the infection to the epiphysis. It's likely that this is an underdiagnosed lesion, although a very photogenic one. Oh, even look here. Look at the thickening and the mushrooming of the cortical bone trying to stabilize this weak area of the bone. But as I was saying, this is probably a lot more common than is diagnosed, because most septic animals often die or are euthanized before bone pain and bone lesions become evident. About 70% of foals with bacterial osteomyelitis will have concurrent septic arthritis as well. Now here's one that looks a little different. This is from an older foal, probably a foal that is 6 to 8 months of age. Okay, we can see this infection has spread through the growth plate into the epiphysis, so the growth plate is destroyed in this area, and it looks a little different. The bone is white. It's not infarcted because we don't see that area of resorption or sclerosis around it. It's white because we've added a lot of cells and we have added a lot of macrophages. This is a lesion that's seen in a small percent, probably less than 5% of older foals or colts who are infected with Rhodococcus equi. And if we took a biopsy here, we would see tremendous numbers of macrophages and rarely some multinucleated giant cells, which would contain acid-fast bacilli. So it's an uncommon sequela of Rhodococcus, but one that looks different than the traditional septic osteomyelitis or suppurative epiphysitis that we see in foals. Now, there is a general rule which often holds up that if multiple joints are affected, we're dealing with sepsis. If a single joint is affected, we're often dealing with traumatic implantation of bacteria into the joint. Sometimes it's a nail that's sticking up. Not uncommonly, these are iatrogenic, where something has been injected into the joint and with it brought bacterial infection. This is a severe case of bacterial osteomyelitis and tenosynovitis, or infection of the joint capsule and tendon insertions. Obviously, this is terrible. If something like this was allowed to heal, you would have formation of granulation tissue, ultimately fibrous connective tissue, which would markedly impair the ability of this joint to move and probably result in ankylosis. Monoarticular arthritis is much more likely to be suppurative rather than fibrinous, and a much more destructive process to the tissues of the joint. It's pretty rare to find bacteria in the synovial fluid, actually. Anytime, and I say this whenever I talk about cartilage, cartilage seems to have a death wish. So dying chondrocytes will release a number of cytokines, including TNF and IL-1, which message the other chondrocytes around them to kill themselves as well. And so once you start seeing cartilaginous damage, it tends to spread fairly quickly. Okay, let's move on to another disease that is primarily seen in young animals, and I'm going to start out with a very large recognizable lesion known as Osteochondritis Dissecans. This is a lesion which develops over time, usually in rapidly growing, rapidly pushed and heavily conditioned foals, often racing foals or somebody that wants to have a big, fast foal. It is the end stage of a disease which is seen in multiple species called osteochondrosis. There are some phenomenal papers out there and a wonderful review in the last couple of years by Dr. Kathy Carlson from the University of Minnesota. And I recommend everybody read that. Osteochondrosis is seen in any animals that are rapidly grown and conditioned. Horses, dogs, pigs, anything we try to get to market quickly. Now, the basis and the easiest way to explain this was an explanation that I got from Roy Poole many years ago, and it still holds up, although we've learned so much more detail about the condition. But essentially, a foal has a normal rate of growth at which the muscles, the bones, and especially the joints progress in concert. When we overcondition these foals, we exercise them too quickly, we put too much stress on a rapidly growing animal, or too much muscle mass too quickly, we alter the growth of the joint, we alter the pressures that are put on the joint when the animal runs or moves. And what that does is it concentrates pressure on the developing cartilage in an abnormal way. Oftentimes this will cause a constriction or an occlusion of the vessels within the articular cartilage, ultimately resulting in ischemia and damage to that cartilage, which will progress over time and get worse, and ultimately may result in a number of lesions, including Osteochondritis Dissecans, where you have necrosis, fragmentation of the underlying bone, and eventually the cartilage, which is fibrillated and ischemic itself, and damage will strip off. The predilection sites, I always have trouble remembering in the horse as opposed to the bull, as opposed to the pig, for osteochondrosis. And that's why they make books. But the predilection sites are the lateral trochlear ridge, the medial femoral condyle, underneath the patella, the dorsal edge of the sagittal ridge of the distal tibia, and various sites in the tarsal and fetlock joints. Sometimes the condition is latent, and the damaged cartilage may be replaced by fibrocartilage, or sometimes it progresses to this particular lesion. Another lesion that you can see associated with Osteochondrosis dissecans in horses are the formation of a subchondral bone cyst, such as this. It happens where there is thinning and a break as a result of osteochondrosis, an abnormal concentration of forces which cause occlusion of the articular vessels, of the articular cartilage, and damage to the cartilage. Remember that the articular cartilage in adults is avascular and gets all of its nutrients from the joint fluid, but in the young animal it still has vessels which are required for its initial construction, and so those are the ones that are damaged. That's why we don't see osteochondrosis develop in old animals. We may see the sequela, but we don't see new cases of osteochondrosis in a 15-year-old animal. Okay, so to get back to the subchondral bone cyst, when you have this little defect, every time the animal walks, it will push synovial fluid into the subchondral bone, which can result in this case, a rather severe cyst. And this is an incredibly painful condition. So another manifestation of osteochondrosis. osteochondrosis. Osteochondrosis is a very common condition, and we don't pick up very many of the cases. We only pick up the obvious ones, generally, which cause gait abnormalities, and in sites that we're very familiar with, as I listed before. Another place that you may see lesions associated with osteochondrosis is on the articular facets of the cervical vertebra. They often are associated with animals with stenotic myelopathy, which we'll cover in just a minute. But what you more commonly see, rather than these large OCD lesions, are asymmetry or osteophytes as a result of osteoarthritis in animals with more chronic changes. You can see these in normal horses as well, so don't overinterpret their importance unless there is a history of gait abnormalities, especially on flexion of the neck. And don't confuse this with, at least these early lesions, with degenerative joint disease, which is very common in older horses. Remember, degenerative joint disease is usually associated with osteophyte production around the joint, especially at areas in which where the joint capsule tends. That's where we start. Osteophytes in arthritic joints always start at the same place, where the joint capsule attaches. And that's why they're usually at the periphery of the joint. They get worse over time, and then because the joint's not really sitting correctly, you will see this eburnation of cartilage. Don't confuse areas where tendons attach in the hip joints as areas of cartilage loss. But when you see this form of fibrillation of the cartilage, you can see down to the subchondral bone, and the presence of osteophytes are obvious. I think that the diagnosis of degenerative joint disease or osteoarthritis becomes fairly evident. Okay, a condition that was very popular in the literature when I was studying for boards, but is still in the literature, just not with the frequency, is cervical stenotic myelopathy, which is primarily seen in thoroughbreds and causes gait abnormalities. It's divided into two fairly distinct syndromes based on the age of the horse, which are referred to as cervical vertebral instability or dynamic stenosis and cervical static stenosis. This is a really nice case of cervical vertebral instability. This is a condition which is seen in younger thoroughbreds, usually 8 to 18 months, and is characterized by a narrowing of the spinal canal when the head is pulled down or the neck is flexed. And you can see what we have here is we have subluxation of the C3-C4 interface, which is causing a narrowing of the spinal canal and an impingement upon the spinal cord. The way they test for this is the animals are led around in a circle, and they usually do just fine. Then when you pull their head down and make them walk in a circle again, they become a little ataxic. Their gait changes. They may kick their front legs, but it becomes noticeably worse. Over time, they will develop damage to the spinal cord and the nerve roots that exit with damage to the axons, spheroid production, Gitter cell infiltration, especially on the underside or the large motor nerves pass. So those lesions are somewhat similar to what you would see in intervertebral disc herniation. It's been theorized that this has been seen in animals that are over-supplemented, over-conditioned, but I'm not exactly sure if that's the case. The second form of static stenosis commonly affects thoroughbreds who are a little bit older, maybe 2 to 4 years of age. It happens a little further back, and this particular condition results in a permanent impingement, often due to the hypertrophy of the ligamentum flavum right here. And you can see how it is pushing up on the spinal cord and causing a permanent or a static compression of the cord. It's usually seen, as I said, further back, C5 through C7. And it takes a while longer. Not only do you see the hypertrophy of the ligamentum flavum, which runs along the bottom of the spinal canal, but you'll also see this sclerosis and thickening of the dorsal lamina of the vertebral arch, which further compromises the lumen of the spinal canal. You may see some associated DJD of the articular facets as well. The gait abnormalities or the symptomatology of this condition is present regardless of the head position of these animals. Okay, let's move away from some of the diseases of young animals, get into some of the diseases that we see in animals of all ages. And I just want to mention, when we look at the bone, one of the things that's important is to evaluate the thickness of the bone, the quality of, or the quantity of the bone. It's difficult in most cases to evaluate the quality if you're not looking at it under the microscope. If you've looked at enough bones, you can tell that this is a reduction in the quantity of the bone, and this is what we would call osteopenia. Osteopenia is a reduction in the quantity but not the quality of bone. A reduction in quantity and quality is a very uncommon condition, and is restricted largely to a disease called osteogenesis imperfecta. It's seen in cats, it's seen in small ruminants, in which it's a defect in osteonectin production, some osteocalcin production, and other genetic defects, which go to make the quality of the bone as bad as the quantity. But this is just quantity. This is the phalanges of a foal whose leg was cast for 2 months. There are a number of causes of osteopenia in the horse. One of the most common causes is shown here, where you can tell that there's just too little bone here in the vertebra, and this is the result of starvation. It takes calories to make bone. Animals that are starved or on poor pasture, that have a decrease of dietary protein or energy, is probably the ones that are more predisposed. What you see histologically, if you look at this, is large spaces between the trabeculi. The osteoblasts are very small and quiescent. Osteopenia is really a disease of a lack of bone formation rather than bone resorption. When we get into that, we start talking about diseases like fibrous osteodystrophy. But strict osteopenia is a lack of bone formation, usually due to agroceriosis. If we go back to the foal's leg, this foal was getting plenty of food. This was a case of disuse osteoporosis. Bone takes its cue from pressure and the electromagnetic forces that course through it when we move and when we walk. So if you are not moving or you are not walking, then you will end up with osteopenia. If you're walking abnormally, you may have sclerosis on one side of the bones in your leg, which is not present on the other. These are people who have been limping for many years. So for bone to form properly, you have to have appropriate amounts of food, and you have to have free movement. Bone is usually resorbed most quickly along the endosteal surfaces and along vessels, and I'll show you a really great picture that will illustrate that in just a minute when we talk about navicular disease. Something else that will result in osteopenia is steroids. Steroids inhibit osteoblast differentiation from their precursors, inhibits the collagen synthesis by these osteoblasts, and it stimulates osteoclastic bone resorption. So those are three good causes of osteopenia in all species: agroceriosis or malnutrition, disuse, or corticosteroids. Let's go back to this great picture, and you'll notice that this vertebra is of normal length, and this one has been compressed because of a pathologic fracture. This bone has gotten so weak that it has become compressed. If we see this in people, they're known as butterfly fractures. If you take a look, you have to, in your mind, just turn this whole picture 90 degrees, and you see this wing that's formed when the bone is shortened and the cortex flares out. They're called butterfly fractures, most often seen in older females who are not getting a good balance of calcium in their diet, and so they are compression fractures of the vertebra, which result in a bending forward. Ultimately, if you can reestablish the calcium, and the cortex might get more strong, but you can't ever fix that fracture. The difference between osteopenia and osteoporosis, two very commonly used words which are often used interchangeably, is the presence of fractures. This vertebra qualifies as osteopenia. This one with the associated fracture qualifies as osteoporosis. So when I ask what's the difference between porosis and penia, it's simply the presence of pathologic fractures in osteoporosis. Just one other small thing which you can see in this particular case is when the bone starts to become osteopenic, you'll see the formation of these transverse reinforcements known as bone bars, which often are associated with osteopenia and periods of malnutrition. Bone bars. Okay, now I mentioned that osteopenia is a disease of a lack of bone formation. Disease that is associated with intense osteoclastic resorption is seen here. This is fibrous osteodystrophy in horses. This is known as Brand disease because it was first associated or seen in animals who ate a lot of concentrate or bran. Horses are very sensitive to dietary concentrations of calcium and phosphorus, and animals that get a lot of concentrate and not much pasture or hay will have high levels of phosphorus in their diets. In most cases, nutritional cases of fibrous osteodystrophy primarily affect rapidly growing young animals. Horses are sort of exceptions because it can affect adult animals just as well. And so when you have a diet that is low in calcium, the body is going to see a need to increase calcium that it cannot get out of the diet. So you are going to have excessive secretion of parathyroid hormone, of course from the parathyroid, which results in osteoclastic bone resorption and liberation of that calcium from the hydroxyapatite crystal within the bone. This change actually occurs all over the body, but in horses it can be extremely prominent in the bones of the maxilla, which will be replaced by fibrous connective tissue. This replacement is always larger than the bone that preceded it. You will see an encroachment on the nasal cavity. These animals often will be stertorous. They'll have trouble running. Actually, they'll have trouble doing a whole lot of things. And one of the reasons they'll have trouble running is because the same process is going on in the long bones as well. But you don't notice that as easily as you notice these big swollen faces. Remember, I said that horses are very sensitive to dietary abnormalities. You can start to see these changes. If the normal dietary ratio for the horse should be approximately 1:1, you can start to see changes in diets as little as 1:3, 1 part calcium to 3 parts phosphorus. You can also see this in animals that are grazing grasses, which have a lot of oxalate, or anything else that will bind calcium. We said that this animal's going to have other problems. Sure, the animal's going to have difficulty breathing. You may see the teeth fall out, or the face may be asymmetrical. In the long bones, ultimately, if you don't see fractures, you may see detached ligaments. We don't see this much today. People are a lot more careful about feeding rations and seeing the early changes here, but there probably is a little bit of subclinical disease out there as a result of which manifests as lameness due to changes in the small bones of the legs. Another reason that horses are very susceptible to phosphorus is they have no mechanism to shut down phosphorus absorption. The more phosphorus you give them, the more they're going to absorb. The body has a mechanism through the use of vitamin D and the activation of vitamin D, where if it eventually will shut down the absorption of calcium if too much is coming in, but doesn't have a similar control mechanism for phosphorus. So if an animal has a high source of phosphorus in its diet, it will absorb as much as it's eating. Okay, here's a disease that we see in horses and in dogs, and you can see it in people as well, in which there is prominent exostosis of the legs, of the bones of the legs. This is known as hypertrophic osteopathy. In people, it's called Marie's disease. This is a disease that really hasn't been totally worked out in the many years that we have known about it, and has often been associated with intrathoracic or abdominal masses in people, dogs, and horses. In the horse, it's been associated with tumors, metastatic tumors of the lung, pulmonary abscesses, or infectious diseases such as granulomatous pneumonia or pulmonary fibrosis. It's also been associated with a number of tumors, including ovarian tumors such as granulosa cell tumors, dysgerminoma, carcinoma, or even pituitary adenomas. One case has even been reported associated with pregnancy and resolved following the birth of a foal. So I used to say it's just ovarian dysgerminoma, but now there's a lot of other things. It seems to mirror the disease in the dog very well. Cause of this disease has never really been proven. It's been thought that maybe pulmonary disease results in vagal irritation, with an increase of blood flow to the legs and the arteries of the periosteum, resulting in periosteal new bone growth. And people experimentally have cut the vagal nerve, and the disease resided. But it's been thought that maybe it's due to arteriovenous pulmonary shunting in the lung. The bottom line is it's a well-characterized disease caused by a number of inflammatory or inflammatory neoplastic diseases in both the thorax and the lung, and has very common clinical signs. If we were to look at just the phalanges here, this could be a great case of ring bone, okay? But it's very difficult to see the presence of this periosteal new bone growth. It's again usually at areas of tendinous insertion in the horse. So hypertrophic osteopathy in the horse, the list of things that causes it is growing fairly rapidly. Trauma. When we deal with horses on racetracks with this tremendous amount of concussion and pounding, degenerative joint disease and traumatic injury is going to be a major problem, and certainly I could show you fracture after fracture. I do want to show one fracture which is particularly interesting, and this is a fracture of the basis sphenoid bone, which is the bone that runs right back here under the base of the brain. And we see fractures and tremendous hemorrhage in animals that flip over backwards. And here's the point of the skull. Here's the occiput. And what happens is they flip over backwards on the back of their head, and all the compressive forces go down into the skull and find the weakest place. And that is where the break always happens. And it's right here at the basis sphenoid bone. And then you have a combination of hemorrhage, often into the guttural pouch. You may see it go down and be inhaled into the lungs. And you may see hemorrhage into the skull and compress the brain. It is a devastating type of injury, and only happens when the animal flips back and hits on the point of its skull. I never know where to put feet. Is when we talk about the foot of the horse, are we talking about the integument? When we talk about the hoof, so I always have a little bit of that in the integumentary section. This time we talked about canker. But most of it I generally end up in the musculoskeletal section, because there are a lot of tendons and ligaments and bony structures here that you have to think about. This is a sole abscess in a horse. It could be through just a puncture in the sole. Looks like this one has been carved out. It could be through a break or a fissure in the junction of the sole and the hoof wall, which is known as the white line. A misplaced nail is something that the horse is often going to let you know pretty immediately that this has happened, and then you have to go in, you have to provide a good area for it to drain out. The problem is, if you don't, then it is going to become a much larger abscess, and it's going to work its way at the junction of the hoof and the sensitive lamina, and it's going to dissect its way actually up and around the hoof wall like this. Because if the hoof is intact, the only place for these to drain is up at the coronary band. And look at all of the separation and separation which is going to occur before it ruptures at the coronary band. You will see in acute cases, you will see swelling at the coronary band. This is also a a really nice picture of acute laminitis. The two lesions are fairly identical in the absence of a abscess here. Then this is a nice picture of acute laminitis. I'm going to show you acute and chronic laminitis, and there's a lot of pictures out there of these two conditions. Acute laminitis is characterized by separation and generally not a lot of exudate, but you will see hemorrhage and separation of the sensitive and the horny lamina. It'll be red, and there will be swelling. Unfortunately, it's cut off in this picture, but there's swelling of the coronary band due to the fluid that accumulates here. Remember, this is the only place that fluid can get out of the hoof, basically. Another thing that you will see is that the bone, the anterior surface of the third phalanx, is approximately horizontal to the outer hoof wall. So we're talking about laminitis here. And look for redness on the anterior surface, but the phalanx is still parallel to the hoof wall. That's what you see with acute laminitis. Chronic laminitis looks a little different. The hemorrhage is gone, and when we look at the anterior surface of the third phalanx as opposed to the hoof wall, you can see that they're at an angle. They're no longer parallel. What happens is you have loosening of the horny keratin lamina from the sensitive lamina, so the bone is somewhat free. Over time, the constant pull upwards of the superficial and deep digital flexor tendons is going to pull the tip of the bone down. It's going to point into the sole. It may actually penetrate the sole itself. Well, what is this white material? This chronic laminitis. And you would think the intuitive thing would be the scar tissue. This is actually keratin. All of those keratinized laminae just grow crazy because they're no longer anchored to the sensitive lamina. So they just proliferate. And this white pad right here is all keratin. In chronic laminitis, you will see that the coronary band is depressed rather than convex as a result of the swelling that you see in acute laminitis. So this would be the picture. So if we take a look at these two, okay, I wish I had them in the same spot, but parallel, hemorrhagic, and the coronary band is going to be bulging out. Here, non-parallel, proliferation of keratin, no longer any hemorrhage, the coronary band is depressed. Navicular bone disease. The navicular bones are sesamoid bones on the back of the fetlock joint of the horse. The superficial and deep digital flexor tendon will pass over that. This is the flexor surface. It's known as the flexor surface of the navicular bone. When there is excessive load on the back part of this bone, it will set off a cycle of exaggerated bone remodeling of the navicular bone. And remember, we said that bone is usually resorbed first around vessels. And that's what's happening here. Around the vessels of the navicular bone, you see this bony resorption. This inset is a normal navicular bone, and this is the resorption associated, bony resorption associated with navicular disease, which parallels the presence and the inflow of blood supply into the navicular bone. Ultimately, you have granulation tissue formation, impaired vascular drainage here, and then ultimately that granulation tissue will form fibrous adhesions to the opposing dorsal surface of that deep digital flexor tendon and cause significant pain and impairment on normal ambulation. Navicular bone is thought to be a defect in conformation. It's most often seen in horses which have upright pasterns, small, narrow, and somewhat upright feet, and what's known as a downhill build. And this almost describes the American quarter horse. You can also see it in long toes with low heels. Think about just the mechanics of an animal with a very long hoof and a low heel. You're going to get constant upward pressure on the tendons and ultimately to the back of this bone. So this is the bottom line for navicular disease. You see significant bone remodeling, especially at the caudal aspect, the plantar, the palmar aspect of this bone, and resorption and eventually fibrosis in the area where the deep digital flexor tendon is supposed to glide across this bone. Okay, that's my picture. That's the one I was looking for, of an uncorrected sole abscess. So let's go back to the sole abscess here. If we don't allow it to drain, it is going to underrun the sole, and it's going to have to go all the way up to the coronary band to rupture here. That's my sole abscess. I was wondering. I apologize for that confusing bit before. So, sole abscess, uncorrected sole abscess, which has just eroded underneath. They did try and eventually correct it. See, now we also have osteomyelitis of the third phalanx. But this one had gone on so long, it ruptured the coronary band, it underrun the sole, and we have osteomyelitis. Okay, so laminitis, red, parallel, bulging coronary band, chronic laminitis, keratin, the third phalanx not parallel, and a depressed coronary band. Good, now I've sorted that out. I was wondering what happened to that picture. Okay. Another disease that we can occasionally see in horses is chronic selenium poisoning. And this is seen when animals are consuming forage or grain that has high levels of selenium. And the pathogenesis of this, it generally is a condition that affects the hair and the hooves, because selenium is readily absorbed in the intestine, and it will take the place of sulfur, which is often concentrated in amino acids that form keratin. And so what happens is you get deficient form of keratin, you will get rings and cracks in the hooves, the hair, especially of the tail and the mane, will break off. These animals are called bobtails, or they have a roached mane. It is simply because selenium takes the place of sulfur. There are some compounds that if the animal's exposed to too much, they like to insert themselves. Fluorine will do the same thing. It will substitute for calcium in the bones of animals that are exposed to high levels of fluorine. So you get cracked teeth, you get chalky white bones with extensive periosteal new bone growth. So selenium substitutes for sulfur in sulfur-containing amino acids. Hey, just a couple of bone tumors real quick. This is a gray horse, and this is a melanoma in the third phalanx and also in the other phalanges as well. Okay. Ossifying fibroma. There are a number of tumors of the jaws or bony proliferations that you can see, but one of the most common that is seen in foals and in cattle is ossifying fibroma. They are tumors generally that appear in or around the point of the mandible. They can be seen in the maxilla as well. This is as you would imagine from the term, ossifying fibroma is a benign tumor, but they can be locally aggressive. Nowadays, they're treated with radiation. A couple of other things that you may see up here would be tooth tumors, much more common in cattle than in horses. fibrous areas of fibrous dysplasia, which tend at least to be radiolucent, foci with bony spicules within them, much more difficult to diagnose under a microscope than they are grossly and with a good radiograph. But if you're looking at a tumor on the point of a mandible of a horse or a large ruminant, I think ossifying fibroma would be a very good thought. Don't forget about fibrous osteodystrophy in horses affecting the maxilla and the mandible too, but these are usually not, they're not bilaterally symmetrical like you would see with fibrous osteodystrophy. There are two diseases that have very old sounding names: pole evil and fistulous withers, and these are both they're related conditions of bursal infection. I guess it belongs in the musculoskeletal. There is, as the ligamentum nuchae passes over the atlas, there is a bursa there, which often, I'm not going to say often, which historically has gotten infected over the years, and it will fester and it'll rupture to the surface. So this is infection of a supraatlantal bursa. And back in the day, this used to be Brucella abortus and Brucella suis. The horses would usually pick them up from cattle in the environs, but we don't see much brucellosis anymore, so it's not a common cause. It can be caused by a number of agents. Today, more cases are probably infected with Streptococcus equi, variant equi. Actinomyces has been incriminated in these as well, but most of them are probably due to strep. Now, so this is pole evil, because this is the pole of the horse right up here at the back of the head. Some people said, well, it is the bridle that's riding and irritating, but this is a bacterial infection, which is going to drain. Very similar lesion is seen in the nuchal bursa, or the supraspinous bursa, and these are the withers of the horse at the points of the shoulders, and this is known as fistulous withers, the fistula being the draining tract here. Once again, most cases now are probably due to strep equi. Onchocerca cervicalis has occasionally been associated with this condition, but usually causes the skin lesions that we see. You can see it in the shoulders, but a lot of horses have onchocerciasis, and this particular condition, fistulous withers and pole evil, is pretty uncommon these days. So I'd go with strep or another common bacterium as a cause of pole evil and fistulous withers. Well, we are going to move into the muscular part of this, and there are a number of muscular diseases. Not all have classic clinical signs. If we look at some of the polysaccharide storage myopathies, they don't have classic clinical signs. I can show you a picture of an animal with great muscle wasting, and that's how many of these present. But I'm not going to do that. We're going to sort of skip those because the gross lesions aren't all that definitive. There are some forms of denervation, like Sweeney, where you have a marked muscle wasting of the muscle of the shoulder. We're going to skip all of those. We'll go to a couple of diseases and then wind up this lecture. This is a condition which is known as exertional rhabdomyolysis. It's gone by a couple of other names like Monday morning disease. And it's a condition in which there is necrosis of the strongly glycolytic fibers of the hind limbs and over the rump. These are the ones that are type 2B glycolytic and type 2A oxidative glycolytic fibers. When you have damage, swelling, edema in muscles that are encased in broad bands of fascia, you will develop a compartment syndrome, which is sort of a vicious cycle of degeneration, necrosis, edema, pressure, ischemia, more necrosis, etc. As we've discussed muscle disease before, you have monophasic and polyphasic conditions. This is primarily a monophasic condition. It comes on quickly. There is no mineralization, and generally the necrotic myofibers are all in the same state. This is a sporadic disease of athletic horses around the world, often young female race horses. When the muscles break down, they release a tremendous amount of myoglobin. So this will interact with TAM horseful protein, and the urine of these animals may be extremely dark. You may have damage as a result of liberation of reactive oxygen species to the kidneys as well. These animals, when you touch them, they're extremely painful back here. That in the presence of the dark urine, and then ultimately testing for the presence of large amounts of myoglobin in the blood will give you a diagnosis like this: exertional rhabdomyolysis. Another myopathy, not really a zebra, although this is a zebra, but one that you can see in a number of animal species, is capture myopathy. Capture myopathy manifests as necrosis of skeletal muscle and edema. This is often a polyphasic condition, because usually when animals get caught up, they have the same reaction over multiple times. In severe cases that are life-threatening, it results in a profound acidosis, hyperthermia, and collapse. The lesions resemble those of nutritional myopathy, but also affect the slow twitch type 2 fibers as well. But these animals tend to recover. You can even see lesions in the heart of some animals. But you want to look for calcification of fibers here, because there's often a history. And then other things that you might see would be hemorrhage within the adrenal. When equids get very stressed, as we discussed in the endocrine system, they may have hemorrhage within the adrenal cortex. So look for multiple lesions in cases of capture myopathy. The last muscle disease that I want to mention is one that is very similar to what we see in cattle with blackleg, but we don't call it blackleg in horses. We call it malignant edema. In horses, it's usually a wound infection. It may start out with something as innocuous as an injection in the neck. And you have traumatic inoculation of potentially a number of clostridial agents. The one that is most often recovered is Clostridium septicum, but you can also see Clostridium novii, Clostridium sordelli, Clostridium perfringens, and even Clostridium chauvii, the causative agent of blackleg in cattle. And if the animal survives, usually there's a large area. Malignant edema is a little different than blackleg in that there is a tremendous amount of necrotizing cellulitis as well as the myositis. And this is the same horse. Initially, the treatment is to incise and let it drain, and then ultimately to take out the dead tissue. And if it doesn't infect the neck muscle, this wound will take a long time to granulate in. The underlying muscle, the infected muscle, will show a lot of the changes that are associated with blackleg. Once again, we call it malignant edema. In horses, you have a pallor, you have a very dry appearance, and you have the production of gas, traditionally seen in clostridial wound infections, which give us these little gas bubbles. Clostridia are ubiquitous in soil and feces, so they can get into any wound. Histologically, you see tremendous amounts of necrosis, edema, and you don't often see a lot of neutrophils because it is such a rapidly progressing, and there is very little blood supply in here, so it's difficult for inflammatory cells to get in and clean these up. If these agents get into the bloodstream, the animals will generally die within 24 hours. So malignant edema, a real problem in horses, and I really feel bad for a lot of veterinarians who just give a regular vaccine in the neck, and then they unwittingly, often through no fault of their own, come back to a case of this. So that's why veterinarians have insurance. Okay, well, that's been about an hour on various musculoskeletal diseases in the horse. I hope you've enjoyed the lecture. I thank you for hanging in there, and I hope that you come back another time to look at more of the diseases of the horse or any other species or organ system. We're winding down on the gross pathology, and most of my gross path stuff is up. I hope to start on some interesting surgical pathology topics, probably going into the summer of 2020. The only systems that I have yet to do the gross on is the gross pathology of the nervous system, and then I do have a number of lectures on gross pathology of exotic and zoo species that I want to get out there. And then we're going to change our focus a little bit and get to some very interesting surgical pathology topics and conditions. So with that, as always, I wish you a wonderful day. I hope you're enjoying terrific health, and because it is December 22nd, I wish everyone out there the happiest of holiday seasons. Take care.